people just started saying, okay, so this is going to be our resus area, and this is going to be our patient holding area, and this is going to be, this is going to be long-term care over here. And we basically just rounded up all the patients. There's this one fellow. He's a long-term care resident. He sits in the lobby every day, drinks coffee, sort of watches the world go by. People show up, he talks to them. It's just sort of what he does, right? He's got a motorized wheelchair, right? And he knows everybody's name. He's known my name for 8 years, And it doesn't matter if I'm in civvies, if I'm in my uniform. I could come in a tutu, he'd probably know who I was. He says to me in the hangar, he says, I want to help. And I said, okay. I said, all right, what can I get this fella to do? Someone in the frantic packing of the hospital that took place as we ran away had decided that we really needed to have our giant yellow emergency response pointers. So all these things that tell us what to do in the state of emergency. I don't know if someone was being cheeky or if someone really did think that was a great idea, or I'm not really sure. But someone had brought them, and they were just sitting on a counter. And I said, Frank, these are very important documents. I need you to look after them for me. Make sure that nobody bothers them. Can you do that? Yeah, I can do that, he says. So he sort of parks his wheelchair in front of these documents on this table. He's helping. When this is all over, I'll buy him a cup of coffee. We set up a field hospital. There were 16,000 people trapped north of town, and they needed medical attention. They needed someone to look after them. So we needed to have doctors, we needed to have nurses. We basically built an emergency room in a hangar. The first night after the patients had gone, Karen Esperson had to watch for the nurses. And, you can always tell someone is either a drill sergeant or an OR manager, because this woman is the person who basically marshaled up these nurses who were exhausted, some of whom hadn't slept, who basically marshaled them up and said, okay, we're going to put this in some semblance of order. So when everybody came in the next morning, they'd gone from a haphazard pile of supplies and a sort of makeshift beds on, mattresses on tables kind of situation to what looked really quite like a proper field hospital. Eerie. It was like something out of a movie. We came to Fort McMurray. We drove into a city that was basically empty. We were given a pretty solid lecture about how we weren't allowed to go to our homes. Basically, we were allowed to go to the hospital, and that was it. The first couple days we were here, the city didn't even have accommodations for us, so we basically camped out at Northern Lights. And that fire chief was able to take a picture of our building. I know you've seen that photo with the lights on from the night. Yeah. Because rumors were nuts. The Facebook was talking about how we'd lost the hospital. The hospital had burned down. People had posted a photo of the smoke billowing from Ambasand over the top of the building, and people were taking it as though the building was on fire. So when we had that photo and passed it around up at Hangartown in Firebag, people clapped and danced and jumped. We printed that photo off and stuck it up on a board to say, that's ours. We're going back. So when we got back in, it was eerie, but it was rewarding. We came in, we saw the place. It was intact. It wasn't, you could tell it was going to smell. The HVAC was off, so the air was stale, and it certainly wasn't equipped for patients, and we're working really hard right now to get it equipped for patients. Went into my office, I signed into Link, and I wrote, "We are still here." My iguana was evacuated through the pet evacuation. She's in Victoria with her breeder. That happened while I was up at Hangartown. So I have a friend who's a firefighter who I owe a steak dinner to, who went and got her for me. I specifically told him, don't pick her up like this, she'll bite you. He picked her up like this and she bit him. In the month of May, I've had 4 days off. HR decided that 217 hours in one pay period was enough and that I had to go have a break, so they sent me away. I'm very, very, very much in awe of the people who took a 4-week hospital remediation timeline and have crammed it into 10 days. That's impressive. It really is. We're going to have an ED. We're going to have all of our services back eventually, and we are going to do what we do. We're just going to do it in a city that's going to have to rebuild. But I know it will. People who've been through this will be able to look at other disciplines within the health service and say, all right, I see their value. You know, we couldn't have pulled this off without the people from MDC who ran around frantically packing everything we were going to need at the hangar. We couldn't have pulled this off without food services. We made sure that there was bottled water for the patients on every one of those buses. You know, there are just groups of people who operate mostly unseen most of the time who really stepped up to the plate that day. I think this is going to be a highlight of my career. I think that I'll be very proud to say that I was here and that we were able to do this, and that we got this done. People are sometimes prone to look at protective services as the people who write them a parking ticket, or the people who, you know, they have to wait 5 minutes for to get a door open or something like that. The thing is that writing parking tickets and opening doors and all of that stuff that we do every day is stuff that we just kill time with between what we really do. And this is what we really do. You know, this is patient safety. This is keeping people safe. This is public order. And that's what we strove to provide that day. Northern Lights never stopped. Northern Lights just moved.